Hola a todos y muy buenos días desde Washington, D.C.
Good
Gracias.
morning, everyone. Good morning from Washington, D.C. Thank you so much for joining us for this virtual press briefing on COVID-19 in the Americas. I am Sebastián Oliel from the Communications Department at PAHO, and this session will be about an hour long, and we will be taking questions up until that point. We have already received questions from you via email, and you will be able to ask questions live by using the Q&A button or the chat. Please remember to include your name and media outlet when you send your questions. Let me remind you that we have simultaneous interpretation services into Spanish and into English. Today, PAHO's director, Dr. Carissa Etienne, will give you an update on the current epidemiological situation about the COVID-19 pandemic in the Americas, and we'll share with you a sort of outlook of the 2020 perspective for this region and the outlook for next year. Dr. Etienne is joined by Dr. Jarbas Barbosa, Assistant Director at PAHO, Dr. Marcos Espinal, Director of the Department of Communicable Diseases at PAHO, Dr. Ciro Ugarte, Director of Health Emergencies at PAHO, and Dr. Sylvain Alighieri, Incident Manager for COVID-19 at PAHO. Without further ado, I would like to invite Dr. Etienne for her opening remarks. Dr. Etienne, you have the floor.
And good morning, and thank you for joining today's press briefing. Since the start of this pandemic, less than a year ago, the region of the Americas has recorded nearly 31 million cases and near 787,000 deaths due to COVID-19. This represents roughly half of all COVID-19 infections and deaths worldwide. In the last week alone, there were nearly 5 million new COVID-19 infections reported, most in North America, where Canada and the United States continue to be the principal drivers of new cases. In Canada, hospitalizations are mounting, particularly in its central regions, raising concerns about hospital capacity. In the US, deaths have surpassed 300,000, a milestone that underscores the human toll of this crisis. In Central America, Panama and Belize are seeing a rise in COVID-19 infections. Some hospitals in Belize are already over capacity, raising concerns about the availability of care. Meanwhile, Honduras, El Salvador, Guatemala, and Nicaragua are reporting relatively low COVID numbers overall. However, we should consider these trends with caution, since hurricanes Eta and Iota may have impacted national surveillance systems, and many people have been displaced from the affected regions. Popular tourism islands of the Caribbean, like Bermuda, are experiencing a rise in infections. And unfortunately, after many weeks, St. Martin and Aruba have recently reported new COVID-19 deaths. And as we look to South America, Brazil and Colombia are reporting the highest number of new cases, with a worrisome rise in infections, and that is happening within Brazil's southeastern regions. Bordering areas in Paraguay and Uruguay are also seeing an acceleration in cases, although both countries are reporting rising infections nationwide. However, we're also seeing a reduction in cases in other parts of the continent. Chile has remained stable, and new infections are decreasing in Argentina, Bolivia, Peru, and Ecuador. Today's press conference will be the last regularly scheduled COVID-19 briefing of 2020. So I would like to spend the next few minutes looking back on what is undoubtedly the most extraordinary public health event of our lifetimes. The Americas are no stranger to disease outbreaks. We experienced a devastating cholera outbreak in the 90s, overcame a deadly H1N1 flu pandemic just over 10 years ago, and saw the arrival of Zika in 2015. In fact, PAHO was founded in 1902, in part due to address yellow fever, which was ravaging our region at that time. But this pandemic stands out in both scale and impact. And it has put a spotlight on two of the long-standing challenges of our region: inequality and underinvestment in our health systems. Latin America is one of the most unequal regions of the world, and COVID-19 exacerbated these inequalities. People living in close quarters or in dense urban communities without the necessary infrastructure were unable to follow the basic public health measures necessary to avoid the virus. The many millions who rely on the informal economy for their livelihoods didn't have the option to stay home. And for people living in marginalized settings and remote areas, like our indigenous communities and migrants, proper health care was often out of reach. Health systems across our region struggled to manage the influx of COVID-19 cases due to limited supplies, space, and staff. The COVID-19 response also disrupted the essential health services that people depend on to manage conditions like HIV, TB, as well as diabetes and hypertension. As a result, patients are at greater risk from these treatable conditions, and our region could lose decades of progress against diseases. 2020 should be a clarion call for all countries to put health first, now and into the future. The well-being of our communities and our economies depend on it. As we look back over the past year, we must also recall that our region matched tragedy and adversity with determination and solidarity. Along the way, we learned several important lessons that have informed our approach to this pandemic and will reshape public health well into the future. First, we learned to follow the latest data to make smart decisions. Within the early stages of this pandemic, our region had access to COVID-19 PCR tests, trained healthcare workers, and a laboratory network that could detect cases within cities and rural communities alike, even before the first COVID-19 patient was identified in Latin America. This strong surveillance system was critical to understanding how the virus was spreading and how our health systems were faring, which helped governments deliver resources and support to areas in greatest need. Over time, this data has also been critical to helping countries assess when and how to adjust their public health measures and how to reopen their economies while remaining in control of the virus. Second, we learned to act swiftly and remain dynamic in our response. At the beginning of this pandemic, governments across the Americas acted quickly to limit the spread of the virus early and buy critical time to prepare health systems for the challenges ahead. The number of ICU beds in Latin America nearly doubled this year, thanks to their swift efforts. PAHO was able to support readiness assessments in more than 500 public hospitals in our region that helped shape country strategies against this virus. PAHO has led hundreds of trainings and donated millions of PPEs and diagnostic tests, and issued more than 100 pieces of technical guidance to ensure that health workers understand the latest science and can access the latest tools that they need to safely combat this virus. As hospitals became overwhelmed, most countries also worked to bring vital COVID-19 support, such as testing and contact tracing, right down to the community level. They also built their telehealth capacity and community outreach programs so patients could access essential health services without ever leaving their homes. This made a big difference, not only in protecting hospital capacity, but also in ensuring that more people could access care. Third, and perhaps most crucially, we learned the power of working together. Within a matter of months, scientists developed diagnostic tests that could detect the virus in minutes, not days. Today, our doctors and nurses are better equipped to manage critical patients, even as hospitalizations are on the rise. And as of this week, some of the most vulnerable people in our region are already receiving COVID-19 vaccines, with millions more doses expected early next year. This timeline is astonishing and a testament to the unprecedented collaboration among scientists, researchers, and experts alike. Global partnerships like the COVAX facility are also pooling resources, expertise, and efforts to ensure that countries have equal access to safe and effective COVID-19 vaccines under the same timelines. The Americas represent 1/5 of all COVAX participating countries, a testament to our regional solidarity and the value we place on collaboration. We also saw this spirit of collaboration reflected in this week's announcement by the Government of Canada that it is donating $255 million, Canadian dollars that is, to the ACT Accelerator to support the development, delivery, and distribution of COVID-19 vaccines and treatments. These funds will benefit several already stretched health systems in our region. We hope other countries will join Canada in its demonstration of solidarity and commitment to promoting equitable access to safe and effective COVID-19 tools. Other major donors to our work include the United States Centers for Disease Prevention and Control, CDC, the European Commission, the United Kingdom, USAID, the World Food Programme, and the Rockefeller Foundation. We are indeed grateful for their support. This year, the Americas, and indeed the world, face the largest public health challenge of our time. But this week, we were inspired by seeing the first people in our region get vaccinated against COVID-19. And while we hope 2021 will usher a new chapter in our fight against this virus, protecting the millions of people in our region with COVID-19 vaccines, we know that this will be a huge undertaking. So we must be patient and remain realistic that COVID-19 will be among us for some time. So our work to control it cannot and must not stop. Controlling the pandemic will require us to heed the lessons that we've learned thus far and to address the challenges that have long held us back: pervasive inequality and underfunded health system. 2020 was a year unlike any other. And I hope that as we look back on it, we remember it not only as the year that brought us COVID-19, but the year we finally decided to make health our top priority. Over.
Muchas gracias, doctora Etienne.
Thank you very
a...
much, Dr. Etienne. And with that, we're going to move on to the question and answer section. And please remember that you can write using the Q&A button, and remember to include your name and media outlet. We have already received several questions via email, and we are receiving some more via the chat. The first question that we have is from Angeline Montoya from Le Monde in France. And her question is, there was a lot of hope that COVAX would allow avoiding the vaccines getting to poor countries months after it reaching richer countries, but apparently the funds have not been obtained. What is the exact status, and could you say which countries in the region that were eligible for preferential access had to postpone their vaccination plans or had to seek agreements with labs? Dr. Barbosa, thank you for the question. COVAX continues with its mission, and this week we had the lesson from South Africa. So 190 countries in the world are participating in COVAX. I believe that's a very powerful message in terms of a process that is very widespread. Because, for example, during H1N1, there was no global coordination, but we do have that coordination today. COVAX is seeking further donations to have the necessary funds to give the countries, not only to 20% of the population, which is already being scheduled for 2021, but rather all the necessary doses that are necessary to control transmission. COVAX continues working, and we already have 2 signed agreements with producers to deliver vaccines, and we also have 2 additional manufacturers that we're working on signing agreements with this year. And as of November 23rd, we started the 3rd phase of this bidding process. And after that, we're going to have the amounts and quantities for delivery in 2021. There are 2 countries in the world that have started with vaccination, and there's a very limited amount of vaccines. It's the United States and UK. So I believe that our strength is that in addition to the countries that had their own agreements and that have quicker access, we will be highly successful to meet our expectations. And that is to say that by March of next year, we will have the vaccines arriving in the countries. And no country, as far as the second question, no country in the region had to change their strategy. Some countries in the region had bilateral agreements signed on their own account to have more options. COVAX was never presented as the only alternative for vaccination access, but the 10 countries in the region that are eligible and that will receive the vaccine without having to pay for it are already accounted for and are in the process of sending all of the documents. So our expectation continues to be very high, and that is that COVAX, in addition to helping in COVID-19, could be one of the ongoing mechanisms around the world to guarantee equitable access to vaccine research, EPP, etc., during public health emergencies of international concern. Thank you. Thank you, Doctor. The next question is from Maria Jose Núñez from Semanario Universidad in Costa Rica, and it says, what have been the mistakes that were made in European countries that pushed them back to confinement, be it errors in measures or population reactions to COVID-19, and what do we have to do in Latin America to prevent this from happening to us? Dr. Espinal, thank you, Maria Jose, for your question. There's not a single mistake or error. It's a combination of factors, rather, that impacted Europe and created this second wave. There are several to note. First of all, let us remember that the first wave went down during the summer. there was a significant reduction in numbers. But towards the end of the summer, we started seeing a rise in cases in Belgium and the Czech Republic. And measures were not taken. The social distancing, hand washing measures, and other had been relaxed. And also non-pharmaceutical measures were relaxed. So that obviously impacted the number of cases. Another significant factor was the lack of testing and tracking or test and trace system, which was implemented during the first wave, but it was discontinued over the summer. And so a little bit later, when the cases started going up, it was a little bit late, and this system was not fully implemented. So like I said, it's a combination of factors, not a single error. Non-pharmaceutical measures, public health measures, and what we saw is that as soon as those measures are re-implemented, because we know that there's been a reduction in that second wave, we're seeing that now, things change. So the thing is that not to forget the measures. If we look at Chile, we see that they have managed to flatten the curve with cases. There will continue to be cases unless massive vaccination occurs, like Dr. Barbosa said. It's a matter of mitigating, not shooting for zero cases. So our message for Latin America is to continue with those mitigation measures to prevent a peak and to prevent further deaths. Thank you, Doctor. We have two questions related to testing in Venezuela. It's from Nicole Yapur from Bloomberg and Mariana Sauquet from Efecto Concuyo. Nicole asks in English.
That 340,000 antigen tests were distributed across most of Venezuela. However, the daily number of new COVID-19 cases has remained relatively low and stagnated in the past month, indicating that testing hasn't increased, she says. Does PAHO know whether the new antigen tests are being administered? If so, how many of those tests are being performed per day? Y Mariana Sauquet de Efecto Cocuyo también pregunta
And Mariana Sauquet asks a very similar question about testing, what kind of information we have, and how can we move forward with the National Assembly and the Venezuelan authorities. Dr. Ugarte.
PAHO handle the antigen tests and the equipment to the National Institute of Health for further distribution to all locations that were agreed. The National Institute of Health then distribute the equipment and the readers and the tests to hospitals and laboratories at the state level. They refer that they had challenges regarding the availability of fuel, electricity, water, but also challenges in training the proper staff and personnel in those areas. But they provided initial information that they have used and implemented around 1,600 tests, and 400 of them resulted on positive. And the Vice Minister of Health, in a meeting that we had with the National Assembly advisor, also indicated that the tests are going to be increased in the following days, and that has been confirmed also by the Ministry of Health. They also indicate that there are additional challenges in terms of operations, and but they will expand the areas of coverage and operationality of the tests. En relación con la pregunta que hizo sobre el acuerdo.
And in terms of the question about the agreement that Mariana asked, the agreement, after several months during which PAHO had to interact independently with each one of the parties, we managed to have both parties meet and agree specific concrete actions on how to make the agreement move forward. And during the last technical meeting that was held this week, additional arrangements were made to implement the agreement. We are optimistic in the sense that that implementation will happen much faster after the events that happened a few days ago. However, we are concerned that the implementation will take place taking other aspects of the agreement. So we have engaged in conversation with both parties to release additional resources to make them available for essential supplies in Venezuela in terms of humanitarian aid, COVID-19 response, and the eventual availability of the COVID-19 vaccines through the COVAX facility at Bajo. Thank you, Doctor. The next question is from Daniel Tunnel from TN23 in Guatemala. And the question is, in the case of Guatemala, are you considering at Bajo a donation of rapid antigen tests such as what you did in other countries in the region, Dr. Alighieri? Thank you for that question from TN23. And I would also like to reiterate the interest in antigen rapid testing. I would like to take this opportunity to go over some of the most important aspects of those tests. The expansion of lab capacity with antigen tests is a significant progress in terms of COVID, and we have highlighted this over several press briefings. The purpose of those tests is to strengthen surveillance at the community level, not replace PCR tests, which are the golden standard at the national surveillance network level. Guatemala had made the decision to use antigen detection test back in August. So they made that decision early on. And the use of those tests was incorporated into their surveillance system. Guatemala is now purchasing antigen detection tests through Bajo's strategic fund. And currently we are processing the acquisition of 500,000 antigen detection tests. However, if cases rebound, Bajo is ready to send an emergency stock to affected countries in order to address the rebound. However, I would like to highlight that the strategic fund at Bajo can provide 24/7 support in making international purchases. Thank you, Doctor. And we have several questions related to vaccines, COVAX, and when we can expect them to arrive in the region. Gisela Salomon from the AP and Gisela Cornejo from El Mundo in El Salvador. Gisela says, some of the countries in the region, including Argentina, for example, have stated that they will soon receive vaccines from Russia and China, even though there is reluctance in providing technical details about it. The question is Bajo worried about this situation, and is Bajo offering any kind of advice or guidance to countries in Latin America? Liliana Cornejo from El Mundo newspaper would also like to know what kind of progress have been made in COVAX for countries that will receive the vaccine for free, like El Salvador. What vaccine and what dose will be given to those countries, and obviously when? What kind of date? That is to say, when can we expect these vaccines to be distributed in Latin America? Dr. Barbosa?
Thank you very much for all of the questions, but the first one in connection with the bilateral countries. The countries do enter into agreements under their own responsibility. The countries do have the sovereignty to decide on the purchase of vaccines, and whoever buys a vaccine should be able to guarantee the efficacy and the safety of the vaccine. To that, the countries do have the regulatory authority, there are regulatory rules, and PAHO does provide technical support to the regulatory authorities in the region. We have been doing this for a while now, and during the pandemic, every 2 weeks, we have held meetings with the regulatory authorities in the region to discuss many of the topics related to the new tests, medicines, etc. So if a country has an agreement, it is certain that that vaccine should be licensed and registered with the authority in the country. For the vaccines that will be purchased through COVAX, and that is the facility that is being led by the revolving fund from PAHO and UNICEF. We are saying that for a vaccine to be able to be sold through COVAX should have the authorization for emergency use by the pre-qualification team with WHO. So for us, the nationality of the vaccine is not important, rather the quality is. So the vaccines will be offered at higher numbers through this facility, and also to reach protection for the most vulnerable groups. So for COVAX, we do need that pre-authorization. So far, no vaccine that has that pre-authorization. The vaccines that already have a license with the regulatory authorities and that are considered as the rigorous authorities by WHO have a faster regulatory process. For example, the Pfizer vaccine that has already been registered in the US and Canada. And these are the regulatory authorities that are included in this list of rigorous regulatory authorities. The pre-qualification as emergency use by WHO will be issued in a matter of days. The other question has to do with the timeline. All of the COVAX countries will receive the vaccine at the same time. The countries that are paying for the vaccine in the region of the Americas are 27, and also the countries that are receiving it as a donation will receive it at the same time and in quantities proportional to their population. So if there are vaccines, for example, for 3% of the population at the outset, all of the countries, and I think that the question was about El Salvador, all of the countries and the 9 countries that will be receiving the donation will be receiving the vaccine at the same time as the 27 countries that are paying the vaccine. That is the principle behind COVAX. We do not have a date yet because, as we mentioned before, we already have a vaccine, but the amount is very small at the beginning. We don't think that any country will be receiving large amounts of the vaccine. Our goal, our expectation is to have through COVAX 2 billion vaccines for 2021, but for the first half of the year, we're expecting 65 million doses. So we are going to have the final information on December 23rd, when we close up the third period, the third stage of the bidding process. We are going to have the bidding, we are going to have the prices, the numbers, and the timeline. I think that some producers already have this agreement with COVAX, and others are negotiating it. Thank you. Thank you very much, Doctor. The next question via chat is by Julian Neves, digital reporter with Loop Caribbean.
How concerned is PAHO about the impact of the anti-vaxxer movement on the vaccine rollout in the Americas? Dr. Espinal?
Thank you for that very important question. We are very concerned. The anti-vaxxer movement is not related only to COVID, but exists before. And in Latin America and the Caribbean, several factors contribute to this. Basically, influencer groups and individuals of influence who promote the anti-vaccine, lack of education and information in low socioeconomic groups also. So it is therefore very important that the national immunization programs continue educating the public about the benefits and the benefits of the vaccines. Vaccines are highly efficacious, are very beneficial. They have saved millions of children. They have prevented millions of deaths from vaccine preventable diseases like measles, diphtheria, pertussis, and several other diseases, yellow fever. So there is no doubt one of the greatest inventions or innovations of public health has been vaccines. So it is imperative we promote vaccines, and because vaccines are tested. Of course, we understand, the COVID vaccine has been the ones approved, manufactured in or produced in record time, but they have followed the phases that are required, phase 1, 2, 3, that are required normally with other vaccines. So there's no doubt when a vaccine is announced that it's 94% efficacious, it will be effective. Of course, there's always some side effects, but not the majority usually. And the history tells us that vaccines are a great public health good, and we should continue promoting vaccines and not abide by the anti-vaxxer movement. Thank you.
Gracias, doctor. La siguiente pregunta es de Giovanni Schiffman.
Thank you. The next question is by Giovanni Schiffman from La Prensa in Nicaragua, also in connection with the vaccines. In Nicaragua, what are the protocols or parameters to be met by the government of Nicaragua for the administration of the COVID-19 vaccine? He's also asking about quantities, and Dr. Barbosa already explained the quantities through the COVAX mechanism, and he's also asking whether PAHO will be working with the country to determine the populations that will be administered the vaccine. Dr. Ugarte, thank you, Giovanni, for this question. PAHO has provided Nicaragua the guidelines for the drafting of the vaccination schedule for COVID-19. We have provided guidelines and support that include the drafting of the plan for vaccination, but also to make sure that first, the priority groups for vaccination need to be identified to have the cold chain as well as the supplies that are needed to timely deliver the vaccines to the population in general. But this was given priority, and it has been already mentioned that the availability of the vaccine will be limited at the beginning. And as you know, Nicaragua is one of the 10 priority countries in the region of the Americas. So all in all, we could probably cover up to 20% of the risk groups by following that roadmap. Yes, PAHO is working very closely with the Ministry of Health of Nicaragua and working with the vaccination team. And we have also maintained and carried out very broad work, and the reports that we receive indicate that vaccination coverage is acceptable, even though it is not ideal, and there have been some achievements for example, the eradication or elimination of some diseases. But in this case, we are vigilant for those processes to continue. We also have multinational agreements for funding that could also facilitate the response to COVID-19. And I think that as part of this joint work with PAHO, we have received positive response by the authority for the mobilization of the funds. Thank you. The next question is by Linda Straker from Grenada.
What is the apparent rate of asymptomatic cases in the Caribbean region? Doctor Aldiguieri, ¿podría contestar?
Yes,
Dr.
thanks a lot,
Aldiguieri.
Grenada, regarding the Caribbean. We do not have specific information of a rate of asymptomatic cases in the Caribbean regions. However, from several studies published in Europe, in the US, in Canada, we know that there is a 40%, 40, asymptomatic rate among the person tested. But we can expect that countries with a younger population pyramid have a higher proportion of asymptomatic infections. In the Caribbean, the median age is 32 years. There are great differences between countries and territories in the Caribbean. It ranges from 24 years median age in Haiti to 47 years in median age in Martinique. So we have a younger population in the Caribbean compared to Canada, 41-year median age, and the US, a little bit more than 38 years median age. So we can expect on average that a somewhat greater rate of asymptomatic rate in the Caribbean compared to the US and Canada. That said, we do not expect that this would have major implications, because the countries and the territories in the Caribbean are well performing in terms of contact tracing and managing also the quarantine of their contacts once detected. So everything in the context of layered measures to control COVID-19 for avoiding transmission from asymptomatic infections. I hope I have answered the concerns from our colleague in Grenada. Thank you.
Gracias, doctor. La siguiente pregunta es de
Thank you,
Ariel.
doctor. The next question is by Ariela Navarro from AFP. She's saying that yesterday, the Inter-American Development Bank published a study based on national statistics that showed that young adults in Latin America are more likely to die because of COVID-19 than their peers from developed countries. Given this situation, she's asking whether the vaccination plans should be adapted or consider vaccinating the youth first, who may be vectors of the disease, of the virus. Dr. Barbosa, thank you very much for your question. There is a great deal of anxiety, and it is natural for everyone to be anxious to have the vaccine as soon as possible. But we are going to see that in all of the countries, the vaccination strategies are the same. The first strategy is to save lives, to protect those that have the highest risk to die due to the pandemic. So this is going to be the first phase, and this is going to take possibly the early months of 2021 throughout the world. And then once we have greater availability of the vaccines, we can think about how to eliminate transmission. So this is the strategy that is recommended by PAHO and WHO. I did review that study. That study compares proportional cases. It doesn't mean that the youth in Latin America are at higher risk of death due to COVID-19, but the populations in Latin America are younger from the demographic point of view. Therefore, the proportion of young people who have the likelihood of dying in Latin America is higher than the number, for example, of young people who die in Europe. But in Latin America, as well as in other places in the world, we see that 80% of the death takes place in the elderly, among the elderly. So there is no reason behind a change in the strategy. The youth will be vaccinated as part of a later stage. The first vaccines should be for health workers, frontline workers, those who work in nursing homes or at home with the elderly. Then we also need to vaccinate the elderly with underlying conditions such as diabetes and hypertension. That is the goal for all of the countries, and that is going to be the strategy to save lives and to use the first vaccines that will be produced and delivered to the countries. Thank you. Thank you, Dr. Barbosa. Another question in connection with vaccines, as we see them here on the chat, Carmen Pound from Politico in the US. She would like to know the following.
Region preparing to deploy vaccines, and how many countries do you expect to start vaccinating people with Chinese vaccines and not wait on Sputnik vaccine and not wait until March? She also says that she knows that there is a fund to help countries in the Americas get vaccines beyond those provided by COVAX. And how does that work? And have you managed, PAHO managed to secure any doses for countries in the region through that? Dr. Barbosa?
Thank you, Carmen, for your questions. Let me tell you, first, how are the countries preparing to deploy? Today, we had the fourth meeting with all the national immunization programs of our member states, our regional technical advisory group, and the national immunization technical advisory group. This is the fourth meeting. We are discussing with the countries in these meetings how to prepare the plan, how to strengthen their capacity to roll out the vaccine, to implement the vaccination campaign when the vaccines are available. Besides that, we have a tool that was provided to every country, and around 20 countries of the regions have already provided all the information. This tool is a kind of a checklist with more than 100 topics that the countries need to assess in order to see if they are prepared, what are the gaps, what they need to strengthen. But we are talking about a vaccine campaign. And the countries in the Americas, they have very successful experiences to conduct massive immunization campaigns against measles, against polio. So this is not a new situation. Just to tell you one important information, this year, adopting new strategies to protect the healthy workers and the elderly people, we got more than 100 million people vaccinated against influenza in this region. So the countries know how to organize a campaign, and we are providing all the technical cooperation that they need to be more prepared yet than to deliver the vaccines to the most vulnerable groups. We don't know how many countries are making this kind of bilateral agreements. Again, these are their decisions. It's not the case is not from what country the vaccine is being produced. The main question is if the vaccine has performed all the steps that every vaccine needs to perform before being licensed and recommended to be used. So I think that we are providing all the information to the countries about COVAX. Again, we have 37 countries in the region that are engaged with COVAX facility. 10 of them will receive the vaccine free of charge as a donation. The other 27 are self-financing countries, and all of them are working together. And this is, I think, that the most important thing. Some countries in the region, the countries that they have money to do that, are making bilateral agreements. But I don't know if this this statement that these vaccines will be in the region before the vaccines through COVAX, I don't know if this is a reality. I don't know where really these vaccines are licensed and where are these vaccines being used. So let's walk the steps that you need to walk and to get all the vaccines licensed, pre-qualified by WTO, purchased through COVAX, that the countries with this will receive high-quality vaccines to protect their population. And the last question is about the fund. Yes, we have a revolving fund. The revolving fund is part of a comprehensive package of technical cooperation that we provide to the countries in the Americas about the vaccines and immunization. And the revolving fund and UNICEF are coordinating, are leading the bidding process for COVAX facility. So we don't have a parallel fund that is making a bidding process, no. PAHO's revolving fund and the UNICEF, we are together leading the bidding process for COVAX facility that will be closed by the 23rd of December. Thank you.
Gracias, Dr. Barbosa. Dr. Ugarte.
Thank you, Dr. Barbosa. Dr. Ugarte, would you like to add something in connection with your questions regarding Nicaragua? Yes, thank you very much, Sebastian. Thank you very much for this opportunity to add some further detail. I mentioned that the vaccination coverage in Nicaragua was good, but not ideal for most of the vaccines. However, I have reviewed the data and most of the vaccines are at coverage level. This is very important to highlight the work being done in that area. Thank you. Thank you, doctor. The next question. This is from Paulina Alcázar from Cancun, Mexico. She has two questions. The first one is that people ask her whether the vaccine will control the virus, and also she's asking about the impact of the disease due to COVID-19 and the likelihood of transmission, and if we have updated information regarding that. Dr. Espinal, thank you very much for the question, Paulina. The vaccine will help control the virus and eventually in the long term, because it's going to take significant amount of time to vaccinate everyone in the world, but this is going to be important. But next year, for example, will be a combination of slow vaccination, but also non-pharmaceutical measures to mitigate, for example, hand washing, social distancing measures that help, wearing masks, and the studies have already shown that these measures work. There have been other studies, but we continue to see evidence that this can interrupt transmission of the virus. So the vaccine will help, but this is not going to happen overnight. As to reinfection is possible, but based on the evidence, the likelihood is low. So that's where we need to focus. We need to focus on the actual infections and creating immunity. It says that the immunity is between 4 and 5 months, takes between 4 and 5 months, but we are also seeing evidence that reinfection may be milder, and also the rate seems lower. Some studies have shown 1 case every 10,000 infected individuals. So public health measures need to be geared to diminishing infections, maintaining the flattening of the curve, and also to mitigating the situation until we have the vaccines, and continue with those measures until we have the vaccines. But we do not recommend to focus on reinfection. The idea is to avoid transmission and new infections, and clearly we need to treat reinfections and also to prevent that they continue to spread in the population. Thank you. The last question is by Beatriz Pascual from EFE. Dr. Barbosa mentioned in one of his answers that there were already 2 agreements signed with 2 vaccine producers within the COVAX framework, and we'd like to know who the producers are. Dr. Barbosa. Thank you for the question. COVAX is a mechanism that is trying to work with a basket of producers. We already have 2 producers that have already signed an agreement that are offering this for 2021. And we also have 2 other producers that are negotiating, and we are going to have even more producers once we close this process for the acquisition of the vaccine that is going to be on the 23rd of December. Moderna and Pfizer are part of the group of producers that are negotiating with COVAX. But this is just to strengthen what Dr. Espinal said today. The UK that already started using the vaccine has declared a lockdown in London. Why? Because the UK itself has a very small number of vaccines, and this is going to take months, weeks, and we have a limited number. We are not only giving priority to administering the vaccine, but also saving lives and also protecting the elderly and people with underlying conditions. So what Dr. Espinal mentioned is applicable. On top of the anxiety for having the vaccine, we need to properly implement the measures that we do know can diminish transmission and also protect the elderly, protect people, and avoid the deaths that are happening in an acceptable way because of the transmission of COVID-19. Thank you.
Estamos llegando al final de este media.
Thank you very much. We're reaching the end of this media briefing today. We still have several questions in connection with vaccination. I have tried to put together the main questions by Alejandro Riano from MinWisconsin.com in connection with the timeline for the vaccine and access. And in English, the question is the following.
To see vaccination happening in the Northern Hemisphere, how soon in 2021 do you expect Latin America and the Caribbean to be fully vaccinated and the pandemic controlled? Dr. Etienne?
So let me thank you for the question. And as I can see, there is continuing to be a lot of interest in the vaccine. Let me start by saying that it is extremely encouraging that we have a vaccine registered and that several more are in late stage development, and that has happened in less than a year. And this really is totally unprecedented. It is truly a historical feat. So developing this first generation of vaccines in such a short time frame, I think was a result of great ingenuity, but also of the robust investment and the global collaboration. What is clear is that without the adequate resources and the effective engagement of the world's best scientific minds, it really would not have been possible. In the same way, our region has to approach access to a vaccine and to other tools with an all hands on deck approach and really unprecedented investments to accelerate access. This is important now as we prepare, and in a few months, once doses start reaching all of our countries in the region. Getting a registered vaccine, as important as that is just the first step. It is not nearly enough to control the pandemic. And we need to take that into consideration. We need to take into consideration that it's going to be several months into 2021 and even 2022 before we can immunize significant amounts of people. What we know is that we've worked hard in the last 10 months, but 2021 will be the year in which we will work even harder. It will take continued unprecedented efforts to ensure, one, that we have enough doses, that we have the appropriate funding and the right programs in place to deliver a vaccine. And you've heard from Dr. Barbosa that we are already working with member states to ensure that they will be ready to deliver that vaccine. But at the same time, countries cannot get complacent. We have to continue to promote the appropriate public health measures to control cases, such as mask wearing and social distancing. These have also been stressed by Dr. Espinal and Dr. Barbosa. And of course, patients will need to be tested, isolated, cared for, and we must continue to quarantine suspects. None of this can stop even as we vaccinate, or we will put too many lives at risk. And we need to reiterate that, because many people believe if you get vaccinated, you are immunized, then you would be able to stop all of the other public health measures. Those will continue well into 2021 and possibly even beyond. So I am fully aware about the enormity of the task ahead. And we must not fool ourselves. It won't be easy, neither is it going to be quick. But ultimately, and I am optimistic about our ability to mobilize the will of power and the resources that will be required in the new year to overcome this pandemic. So it is a long haul, and we are going to be in it together and for the time that is necessary, that we can confront this pandemic and stop its transmission. So let me take this opportunity to thank all of you in the media who have accompanied us for the greater part of this year and that you have supported our work. And I want to take this opportunity as well to wish all of you a joyful and a safe holidays and best wishes for a happy, fulfilling 2021. Thank you, and we'll see you on the 4th of January.
Muchas gracias, doctora Etienne, y muchas gracias a todos por acompañarnos.
Thank you all for being with us today. As Dr. Etienne mentioned, this is our last briefing this year, but we shall continue in January next year. Once again, you know that you can continue in contact with us via email, phone, and you can also obtain information at www.pajo.org.covid, and then coronavirus. You will obtain this information about this briefing today. You will have the opening remarks and also greetings and happy holidays.